Breastfeeding mothers need all the support that they can get because the length of breastfeeding is highly correlated with the amount of support available for moms. I want to draw attention to occupational therapy in relation to breastfeeding. Now, this is an area that we wouldn't normally associate with breastfeeding, and yet surprisingly, it can be very helpful. Considering that occupational therapy is often covered by insurance, it is good to be aware of this alternative resource that we have at hand. My guest today is Kinzie Weiss. She is a pediatric occupational therapist who specializes in lactation. She will walk us through all the many ways that OT can help breastfeeding mothers and their babies. Make sure to like and subscribe, hit the bell for notifications, and keep your ears open for our upcoming fundraiser for the breast pump that mimics suckling. And now, enjoy the talk. All right, I'm here today with Kinzie Weiss. Kinzie, thank you for joining me.
Thanks for having me.
When I think about occupational therapy, usually thinking about how one can engage in everyday activities after an injury or illness. And OT, I would say, is not something that generally would come to mind in relationship or in relation to breastfeeding. So how can occupational therapy be relevant here? How can it help breastfeeding mothers?
Yeah, so there's quite a few different avenues that we can help. So like you mentioned, getting back, OTs really help people get back to what they want to be doing. So we look at someone, we say, okay, what's their occupation? Are they working? Are they, taking care of a parent? Are they taking care of a dog? Are they doing this and that? So then that also applies to an infant. So we say, oh, what's an infant's main job? An infant's main job is to eat primarily, sleep, hit those developmental milestones. So it's really in our scope of just a different population of how we can help them. So we also have like a really great vision that we look through it of saying, okay, what physiological things can we help the baby with? So oral motor skills. And then from the breastfeeding point of view, we can look at the mother as well and say, okay, what physiological things are happening with her? Like, how's her posture? How's her mental health? That's a big thing OTs are really striving to make progress in, is mental health. So we kind of just have this all-encompassing view of the mother and the baby. So that's really where this like great marriage of an occupation and a task kind of intersect, is we really can look full circle around, okay, how's the mom feeling? How's the baby doing? We can look at mental things and physiological things. So I think that's what's really special about OTs. Some professions focus on one or the other. And so I think that's really where we shine, is we can say, especially when there are greater breastfeeding certifications achieved on top of the OT, is we can say, okay, I'm going to take a holistic view of mom and baby. But again, I just love to emphasize the mental health aspect of it, because we have during school a whole curriculum about mental health. And as you've seen in the news, it's a really, really important thing and a really, really big deal right now. And so I feel like that's where we can also really shine.
Mm-hmm, mm-hmm. And does it mean that like occupational therapists would have a general understanding of how to help specific breastfeeding difficulties as well? So like say whatever lactation consultants have knowledge of, would occupational therapists would have knowledge of as well?
They would have a very, very small
Mm-hmm.
knowledge of that. So lactation consultants, they are gold. They know they know what they do. So that's why I think it is important that if an OT or a speech or a PT or someone is going to go for a breastfeeding certification, then that's necessary. You can't just come out of school and say, sure, I'm going to treat breastfeeding. You for sure could potentially like treat the mom of, okay, what's this positioning? like how are her ergonomics, how's her mental health, but so far as like the specific, how's the latch, how's the tongue function, how's the milk supply, all of those things, those are really specific, and those need to be really specialized in.
Right, right. And to your knowledge, is this something that picks up? I mean, are there more and more occupational therapists who would pick up that knowledge or add that certification
Oh
to
yeah,
their?
yes, there's a wonderful two OTs who also became lactation consultants, started a website, the Lactation OT, and they offer these very specific like bottle feeding the breastfed infant, and they get all of these experts to come and do their continuing education, and it's just such a wonderful resource on top of obtaining a specific breastfeeding certification that kind of bridges the gap of, okay, you have your OT knowledge, you have your breastfeeding knowledge, and then how do those really connect, and how do those, like, where can we find our niche for these things? So those oral motor skills again, connecting what's the right kind of bottle. Well, is the baby being held appropriately? Are they in the correct sensory state? Are they active and alert and quiet, or are they freaking out because there's too many lights on and the TV's going and all of the things? So again, there's just like another little facet of how OTs can really prep the environment for not only the mom, but like, is mom rested, hydrated, all of those things, but for the baby as well of, okay, maybe we need to swaddle this baby during feeding because they need that input of being just that proprioceptive input. So there's that really cool aspect of where we can intersect and use our skills to specifically help breastfeeding.
All right, that's very good. Can you give a few examples from your experiences with mothers who had difficulties with breastfeeding or came to you saying something is not right, and you were able to help?
Yeah, I've been getting actually a lot of bottle refusal recently. And so usually that happens around 3 months when sucking becomes less reflexive and more volitional. So that's where it's so important to work with the mother and make sure their supply is great and all the things, and that the baby is latching to the mom. But when you're doing bottle refusal, to make sure those oral motor skills and the bottle flow rate. Are you positioning the baby correctly? So many people will attempt to do, it's called pace feeding, where the nipple is only halfway full. But the ideal position is, if a baby is sidelined, do they need to be in a gravity eliminated position? Do they need to have input to their feet? Do they need to be kind of rocking and have that sensory input? So that's kind of what I've been seeing a decent amount lately, just because it's such a hard transition, especially if the mother has a very strong letdown and the baby doesn't have to use very good oral motor skills. So that's really, really the culprit I've seen lately is a mom will have a very strong letdown. So the baby is living on the letdown. They don't have to work hard for it. And then 3 months later, that reflex is gone. And then the mom is offering a bottle. So they can breastfeed just fine because they're still getting that onslaught of milk. But when they're asked to take a bottle, they're like, uh-oh, I have to learn how to use my tongue appropriately, lift and cup and pull when, it's not a reflex anymore. And I actually have to like think about this and then perform it. So it's very, that's something I've really been seeing lately. And which I think is cool too, because I'm working with a mentor to get hours for my lactation consultant. And she sees a very different population that is mostly exclusively, how's the mother pumping, what are she sees a lot of milk supply goals and a lot of baby weight goals. So I haven't seen too many of those, but I do see a lot of, okay, we're starting solids and we're having nursing strikes, and just more of those like super dynamic, there's more than one or two systems going.
Mm-hmm. occupational therapy would be accessible through insurance, right? So most insurance plans would cover occupational therapy. So that relates as well to breastfeeding, right? So if somebody comes to you with breastfeeding issues, they would be able to get reimbursed through their insurance.
It honestly, I mean, here in America, it depends on what the insurance is. And then it stinks too, because I know some insurances don't cover lactation if the baby is being formula fed or is bottle feeding. But you're like, no, but that's a necessary skill, friend. Like, where are
Yeah.
these people going to get help? So there's again a huge disparity of help available, and that's actually why I don't take insurance. I am private pay only.
Mm-hmm.
I do not want to deal with what's covered, what's not covered. I want to spend as much time as I want to with the family. I want to not be pushy about, frequency or getting a technical assessment done or this or that. So I really am able to meet the family where they're at and not say, okay, we need to get X, Y, and Z done to make sure insurance covers this or to do all of those things. So I am private pay.
Yeah, private pay.
Mhm.
Yeah, but I understand that in that way you are more able to kind of tailor your services to the family's
Mhm.
needs as opposed to the insurance plan's needs.
Mhm. Yes. For example, we with my son, when I feel like when you're a provider yourself, you probably second guess yourself even more than regular. But my son he had his anterior tongue clipped in the hospital, and then his posterior needed clipped. And so I was debating for a long time about whether to go get it clipped when I knew it needed to be released. And
Right.
so I was trying to go see another provider in the area, and we have like if we meet our deductible, then everything's free, but we pay for everything 100% until we meet our deductible.
Yeah.
So they had quoted me, I think it was between $400 to $800 per person. So that would have been for me and for my baby. So that is not obtainable on any level. So that's also why I'm passionate about, I have one flat fee, and I charge technically like by the hour, but I will go and spend an hour and a half just making sure everyone's good. But yeah, I think it's
Right.
a huge difference of what insurance doesn't cover, what they do cover, or something like that.
Right. Right. And you would actually visit the family. So you go out to the family or they come to you?
I go to the families, which some providers hate that, but I am super passionate about it because I've noticed, like, I previously worked in a clinic and I loved it. It was great, but I noticed that it was so hard when the chairs aren't super comfortable. The mom doesn't have her burp cloths, or her mom doesn't have her jammies on, or baby doesn't have, you know, they've been traveling for a bit or something like that. So
Mm-hmm.
it's so much different. Again, OTs are really big on setting up the environment to set it for success. So when I go to their environment, I'm able to utilize what they have to make everything great. So sure, maybe I have this funky pillow in my office, but at home they don't have that. So I want to make sure that they can be successful in their environment using their things. So that's also I do breastfeeding, and I also do like 0 to 6 months. So if there's any kind of developmental delays, we work on that as well, because again, it's their environment. So I could make a fancy obstacle course all day long at my clinic, or my office. But again, if the family can't go home and replicate what we did, then sure, it was helpful, but it has the potential to be way more helpful if it's at their house, if I'm
Yeah.
giving sensory strategies for people at their house. And this all came about because I was doing starting solids with kiddos at the clinic, and it was not their high chair. It was, a very limited amount of food of, okay, sorry, we only brought this like blueberries. And you're like, oh man, I wish we could have tried, you know, your native dishes, or I wish we could have tried something you cook all the time, something like that. So that's really kind of where this whole stemmed was. I wasn't happy with, I could have provided better care when it was their high chair and their utensils and all of those things that make them comfortable to be successful.
Absolutely. Yeah, it makes sense to kind of work from their own environment and establish all these routines within their environment. And I bet they would stick to it easier and better as well. So the
Yes.
success rate or how long they would keep to it would depend on that as well, that you don't have to go home and translate everything that you just learned in a totally different environment and try to apply it in your own home.
Yes. Well, and then that's the thing too is I recommend oral motor exercises almost across the board. And so it's so great to be like, okay, hey, when you do a diaper change, this is when you should do it. Or whenever you're doing this, that's when a great time to incorporate it. So it's great to really see their routines and where I can fit into their schedule. Because again, like I am all about serving the family. So where can I give you tools to fit in to make you successful?
So what I wanted to ask you is, for me, it sounds like that OT is not obviously not an exact alternative to lactation support or lactation consultancy, but it's looking at breastfeeding from a different angle that might be just as helpful to improve breastfeeding in general for mom or for both mom and the baby. What would be your recommendation? Like what issues or problems you would say for a mom, right, this is more for a lactation consultant, and what problems they would say like, yeah, this is more like for an OT to deal with?
No, that's a great question. So it depends kind of what you have available. So, like I said, there's some OTs, which hopefully I'll be one soon, who's an OT and a lactation consultant, that I think would be the gold standard because they have that very solid base of both professions. But if that's not available, which hopefully it's becoming more and more of a trend, but definitely not right now. So an OT, I think you could go to for a lot of oral motor skills of, okay, the baby's not using their tongue correctly. They have some torticollis or some posture things going on. That's a big thing. They have tension. That's also a really big thing that I do is working body work for breastfeeding of not only, you know, they had a tongue tie release, you know, that fascia is all the way throughout the body. So if they're still tight from the release, then we have the tongue to work on, but we also have the hips to work on, and we also have the feet to work on, you know. So I think that's a good differentiation of where an OT would shine. But you know, a lactation consultant are phenomenal at what they do for supply and you know, some of the very physical things on the mother, pumping, you know, so things like that. It would be very much like that's each other's fields. And then an OT who has dual certifications, that's when you could just see them exclusively. Does that answer your question?
It pretty much does. And actually, I was just thinking while you were saying that there could be things like the things that you listed out. I would not think of them as a mom, right? So for me, it sounds like it's worth checking out these things with an OT, because there might be some hidden things, what you said about the hips and the feet, that I might not even think about, that is relevant, or that might be like that tension might be uncomfort for the baby, and that's why they cry, and maybe that's why they are not latching properly. Or so these things actually might be something that the moms themselves can decide that, oh, I need a lactation consultant or an OT. It's worth have a look or ask for an opinion
Right.
from an OT for these things.
Right. Well, and then even going back to that bottle refusal, you know, if the mom's supply is great and breastfeeding is going great, you know, lactation consultants for sure have a really great knowledge of bottle feeding, but they also, you know, but an OT would have a little bit different viewpoint on why they're not taking that bottle. Does that make sense?
Yeah, it does. It's very interesting. It's very interesting.
Oh yeah, no, it's so multifaceted, and it's just amazing to kind of work through, especially tension. I know my mentor, you know, we often refer to a chiropractor or an OT for working out that tension. Like, she is so great at identifying it and then providing the right resources. So I think that's again where an OT lactation consultant could really shine, is they would be able to, you know, identify, make sure the milk supply is going strong, and help, you know, exercises to work through that tension. So an OT by themselves, I think needs a lactation consultant to, you know, that marriage is just amazing, whether that's one person who has both of those or an OT who is very connected with a lactation consultant.
Yeah. That's all the questions I had. Do you have anything else to add? Any advice or any thought that you would like to add to this?
No, I love what you're doing. I'm really so excited to be part of something that helps normalize breastfeeding, that helps normalize issues. So I'm really just again excited to be a part of what you're doing to help spread awareness and to get the word out there about resources. And oh, my baby has tension, or, you know, has a very strong side preference, maybe I should look for an OT, you know? So again, I think this is a really great resource that parents will appreciate, and practitioners.
It's great to know that moms have other options as well. They can expand the help available to them by, for example, going to you or other OTs who have this specific knowledge. And hopefully this will, again, be something that they pick up. Or more and more OTs might have this additional certification to help moms. So best of luck. I really wish you all the best of luck with this, because I think it's great what you do. I think it's a great help. Sometimes I speak with a guest and feel like, oh, I wish I knew that when I was breastfeeding. My baby was small. My son had tongue tie as well.
Right. That tongue tie is just absolutely wicked, because, you know, it happens so early on in utero. And so they don't get all the practice that they need. And then it does take a while for providers to figure it out. You know, they usually find out when it's, you know, the mom's nipples are bleeding, or the baby's not gaining weight, or, you know, something kind of traumatic usually has to happen for a very detailed identification of those ties. So you know, usually moms just give up breastfeeding because it's just so painful, or you know, what have you. So again, it's tongue ties are a new, you know, very, very wicked thing, especially then to rehab, because it takes about 2 to 3 weeks for baby to really figure it out and regain function. And there's a lot of work on them on the part of the mom to do those exercises and make sure scar tissue doesn't come back, but also to do those suck training exercises.
Right, exactly, because you don't want to lose the momentum.
So those tongue ties are a really, really kind of wicked thing, because they impact so much.
Right. Again, thank you so much for your time. That was very interesting to learn about all this, and wish you all the very best.
Well, thanks for having me on.